Hi, I'm Drrodrohrich, board-certified plastic surgeon in Dallas, Texas. Welcome to Rohrich Knows Podcast, helping you become a better and more informed you. Today, let's talk about peels, chemical peels. I get asked this a lot. And how does a chemical peel differ from a fruit acid peel, from a laser peel? Let's take a look. Let's take a look at what a chemical peel is and when is it indicated. You know, chemical peels are skin resurfacing procedures, and that's where you put a chemical onto the skin and to remove the top layers. Not all the layers, the top layers. And it helps improve skin texture and tone, reduce the fine lines and wrinkles, and also it's been used to treat acne scars and hyperpigmentation. But some peels are better than others, so let's do a deep dive into that. And when you look at the type of peels, there's a superficial peel, the moderate, and then the deeper one. Now, the results get better as you go deeper, but the recovery is also longer. So if you have a superficial peel or the lunchtime peel, you can do that in somebody's office, you can do it at home, and of course there's no downtime. But the result is transient, looks good for a few days. The longer you go deeper, the longer the recovery, the better the result, but you'll have a longer recovery. And so let's go. I'm going to talk a little bit more about what's called a trichloroacetic acid peel, but let's do a little overview of the chemical peels. So a superficial peel, one just takes the outer layer of the skin off. Mild peel, things you can do at home. They're very safe. They kind of give you more texture and tone. Medium ones go a little bit deeper, probably 3 to 5 days recovery. The deeper peels, they're 7, 10, and sometimes longer. They go for more, significant skin problems. So fruit acid peels are the superficial ones. Glycolic, lactic acid, citric, malic acid, they're all very good for improving skin texture and tone. Salicylic acid, that's one of the most important working tools in acne care. It's a beta hydroxy acid. Always make sure that your acne has salicylic acid. And that's really one of the most important things because it really helps to effectively treat acne in these areas. So skincare is great. This is someone that just was on a ZO skincare and just helping improve your skin with the use of powerful retinol. And that's really unbelievable because if you do it consistently and avoid the sun and follow a regimen of a retinol with intermittent peels, you can get amazing results. But I'm going to talk about combination peels. And I'll refer you to another YouTube that I've done on lasers, which are for a different type of patient. But a combination peel are for those patients that have moderate to fine to moderate wrinkles and want to get improved texture and tone, but also have some pigmentation issues. So if I combine a trichloroacetic acid peel, which is a deeper type peel, with a Jesner's solution, you get improved results. So what is Jesner's? Jesner's is salicylic acid. Remember, that's a beta hydroxy acid with a lactic acid and a resorcinol. And what this does, it helps to remove the fine superficial wrinkles, but also helps to prepare the skin for a trichloroacetic acid peel. And I like to use a 35% TCA peel. So I'm going to show you a peel that actually is a video to give you the power of, you can do this in the office or you can do it in the operating room. Sometimes I'll do it in the operating room, but this one happened to be done in the office. So we'll turn up the volume on this and give you an idea of what's possible with this type of peel. In step one, there are 4 different steps. There's alcohol, acetone, which is a degreaser, and then of course the third one is the Jesner solution. That is that takes off the superficial layer of the skin, and then the last part of the 4-step peel is the trichloroacetic acid. That's the power. So alcohol to cleanse, and acetone to degrease, and Jesner's to take off the upper layer, and then the trichloroacetic acid peel. It's very, very powerful. And you can shape it and contour it very nicely. So this is a patient where we're doing a skin prep only. And the key is you want to cleanse the entire face with alcohol. And this is very powerful to do. And when you're doing that, you're going to do it with to and fro motions of the face and shape and contouring, and you can really, really get some good shaping in this area. And really what you're doing is you're cleansing the face. And you can do this, obviously in the office. We usually have the patient take a Valium PO before this. There's a fan going on in the background, and we have some ice available. And so this cleanses it. The second step degreases it, especially when the patient has oily skin. And the oil really, every time you're cleansing and degreasing, you're making and setting up the trichloroacetic acid peel to be more uniform and to be better. And so this patient had a degreasing agent with acetone, and again, you're doing a to and fro manner procedure where you're bringing this and doing it and really shaping it. And so that's the second part. Now, the third part is coming up, is called the Jesner's. And the Jesner's solution is really important because it takes off the superficial layer of the skin. It's also not very, it's not uncomfortable because this is the first lunchtime peel. And so this is again done in the same to and fro manner, shaping and contouring this area. And you're really doing it very methodically. And again, the patient's very comfortable, and this can be done in your office. And so we wring it dry, we really shape it and contour it. And again, we're doing the entire face, temples, cheeks, eyelid areas, and really doing just very nicely to shape and contour this area. And that's done very methodically again. And so when we're doing that, we're really making sure that we get every area, because we've cleansed it, we've degreased it, now we're taking off the superficial layer of skin. All in preparation for the finale, the fourth part, which is the trichloroacetic acid peel. So we're doing that, and we're shaping it and contouring it, and you're really getting all of that done. So now you're ready. It's a 3-step prep, and then you're going to do the big one. And that's the trichloroacetic acid peel. And I use a 35% peel, and it really helps to give you a very nice, uniform peel in this area. So I'm really cleansing this area. It really helps to take your time in doing this because it makes the final process so much better. So we're seeing that, and then we're going to do the TCA peel. So now, this is very important. We're going to bring the TCA, and we're going to wring it out and make sure it doesn't have any droplets, but really all into the 2x2 gauze in that area. It's very important. Notice how I'm wringing it out there very carefully and making sure that it's all very, very moist, but not dripping, because this is a very important process. You don't want to get any of this in any orifice or the eye because it can be somewhat irritating and damaging. So I always grab a gauze that's clean and shape it and contour it. So we're doing it one hand with the to and fro motion, and the other hand with the gauze in place. And so we're starting at the top again, and we're going to go. Remember, it's all about depth and penetration. So it's the number of strokes, and it's also the pressure you apply, and it's the to and fro motion. So it's 90 degrees to and fro motion, shaping and contouring. And really, you're doing that methodically, each aesthetic unit of the cheeks, the eyebrows, and that really, really, really helps to shape and contour it. And when you're doing that, you're really making sure you're watching the skin. It turns red. And then when that entire area turns red, and then all of a sudden it turns into a pink, and then it turns into a pink white, and then it goes into a lighter white. And that's the end point. You shouldn't go further than that. And the delay is about 2 to 3 minutes. You can see already that there's some whitish, pink white in that area. And so that means you've really, really prepared the skin beautifully. And that's exactly what you're doing here. So you're doing it methodically, left cheek, forehead, and you're really going through that to and fro motion, the 3-finger technique, and really shaping it and contouring it and doing it at 90 degrees to each other. And then you're really going with deeper pressure around the lips and really shaping and contouring that area. And you're doing that, and that really, really helps. And I can't overemphasize the power of this. And there'll be some discomfort so that the fan is going in the background and we'll get some cool ice going. And she's fairly comfortable here. And like I said, many times we do it in the operating room in conjunction with other procedures. But it really helps to shape and contour this area. And we'll do that in this area. And then in the neck, you can do it, but you have to do it a little less gingerly because the neck skin is a little thinner. So you really need to do it lighter, as in feathering into the neck area. And that's exactly what we're doing here. Obviously, we're doing the lips a little more deeper and with deeper pressure because the wrinkles are deeper there. So you want to really, really get deep in that area. And you're going to see that really shaping and contouring. And you're getting that white, red endpoint, and that's really what you want to see in that area. And so you're going to do that throughout this whole type procedure, and you're shaping it and contouring it in this area. And so you'll see all of these results here, and then we will show you her pre-op and then her 1 month post-op as well. And this process takes about 20 minutes, and then the other thing is the recovery is about 7 to 10 days, and the key initially is there'll be some burning initially for about 15, 20 minutes. Then after that, it'll be fine, and then it'll start peeling in about 2-3 days. The key is to keep it quite dry, except for lubricating around the lips and the eyes, and allow the peel to come off naturally. And then over a period of 10 days, you'll see really the rebirth of your normal skin. It'll be pretty amazing in this area. And you'll see the shaping and contouring in here in this area, and then we'll be moving this to the post-op and shaping it. So then ice is applied as well as ointment. Ointment is applied, and then we will also do some finesse TCA in the lower eyelids with a cotton tip applicator. You have to be very careful to not obviously get it into the eyes, and just shape it in this area. And that's done very, very gently in this area. You want to make sure you don't ever get anything into the eyes itself. And this is done bilaterally. We do it in both eyes, lower eyelids, and you shape it and contour it. And this is done with gentle strokes. Don't drench the TCA, but just have a very moist cotton tip applicator in that area. And you do the corners of the mouth and the fine rightids, and there you are. And she's really quite comfortable. She just has had, you can see the fan is blowing on her hair, and we have ice in the background that we'll place on her face. That'll cool down in the next 20 minutes. So here she is pre-op, here she is 1 month post-op, shaping, and she's gotten her pigmentation resolved. She's got much improved shaping, and the fine rightids are so much improved. And again, it only gets better with time. And you can see here some other shaping and contouring. And, and many times I do it in conjunction with a facelift, especially the perioral area. So it's sun avoidance, sunscreen, bleaching, retin-A, all these things you begin in, you have to do it categorically. And here's an additional patient that had this procedure done. She's 8 months post-op. So here's another patient, 35% TCA peel. She's 6 months post-op. You can see she's had an incredible improvement in the pigmentation, the fine wrinkles in her face. These are all very powerful. Here's a lift and fill facelift that had a peel done of her central face, perioral and forehead area. Again, this is 3 years post-op. Another patient had a peel done in the central face, eyelids, and perioral area. You can see she looks excellent. So peels are fascinating, and they are very powerful because you can restore shape and texture and improve fine wrinkles. The deeper phenol peels and crotonol peels are ones I don't do because they really require a much longer recovery, and have some potential for risks, so I don't do those peels. There are people that do them, and they're fine to do, but I actually like to and have mastered the TCA peel. So hopefully you'll find this has been very helpful to understand what a TCA peel is, what a fruit acid peel is, and giving you some guidelines for when you need them and what the procedure is like, and then the post-op care and instructions. So know before you go. Obviously, there are risks with any procedure. Obviously, make sure if you have any history of cold sores, make sure that you're on a antiviral agent for about 5 to 7 days post-op. And find a qualified and expert that understands the power of peels, and so that you can get a great result. So know before you go. And please give me your comments and thoughts about chemical peels, its uses, and see if you're a candidate. Till next time.